Yeah. Okay. So that's just one part of it. The other part is, you take you take the scan, and then you have to have a design service or AI to basically give you a proposal of the restoration.
Mm-hmm.
And then there's the printing and manufacturing. Okay. There's like 3 parts.
Yep.
Inside the CEREC world, there is excellent AI that gives you a proposal that sets you up for manufacturing pretty well. But in 3D printing world, a lot of dentists don't realize that the designing, even just a model, setting it up in a slicer program is really challenging. And that's where it falls on its face.
Yeah.
And then they also don't realize the amount of mess that comes with printing, right?
Yes.
So can you tell me a little bit about like where the state of the art is in printing? Because I was thinking like there was a race between milling and printing. And I think when I talked to you and you were like, nope, printing is going to win that for sure.
Yeah.
Because milling is what we're doing with CEREC, like single crowns or like maybe a full block of zirconia.
Mm-hmm.
Why can't we get a robot to mill a puck? Let's say you want a denture, because I think you can mill a pretty large puck.
Yeah, you certainly can.
You know what I mean? Like, and then
for a denture,
and have like pink on one side and white on the other,
mm-hmm.
and it mills. Something like that. And then, okay, so for milling, there might be a little bit more waste, but it's dry waste, and it's probably easier to process than like resin. And maybe there's less curing, because that's done.
I mean, curing, it's still like if you're milling something, it still has to go into the furnace, mm-hmm. which is kind of like the cure in a sense. Mm-hmm. It solidifies all the materials and the properties to make sure that it's going to have the, mechanical strength that it needs. Mm-hmm. And if you aren't, putting it in a furnace, then it's not going to be as solid as it should.
Right.
And so, the furnace, it really depends on what, mill we're using and the material, how long it needs to be put into the furnace. Because some things take 7 to 8 hours they have to cook in this furnace.
Right.
Versus some of the other materials that have been like pre-sintered and you don't even have to put them into the furnace, which is what CEREC has done with some of their blocks, and some other mills have as well. But yeah, you kind of touched on it. There is, maybe a little bit more waste with milling, but mills aren't going anywhere for some time, just purely from the strength and quality that we're able to achieve out of a mill. No one's really achieving out of a 3D printer yet, but it's getting close. And a lot of people feel the same way. Maybe 5 to 10 years from now, we'll start to see mills start to be phased totally out once the materials for the resin, they start innovating and coming out with these new resins that have different strength qualities to them, and they start to look just as good, if not better. And we're able to do it much faster because printing is faster. There's, the cure time for a single unit crown, you're looking at like 3 to 5 minutes. Once we release our new printer here in September, it's already out in Europe, but here in the US come September, we'll be able to do a 40-minute turnaround time on a crown. That's, it's not going to have the same quality and aesthetics maybe that a mill would have yet, but it's very, very close. And in the next year or two, some of the resins that are coming out are going to start rivaling the strength of the natural hardness of our dentition. So it's really coming a long ways, and that's just in the next year and a half. We'll see in 5 years the kind of materials that are coming out. And what's cool about Shining 3D is we're an open system. So we don't lock people into only using our resins. If some new manufacturer comes out with an amazing resin that is, taking the dental world by storm, then we're going to be able to adapt and bring that into our system. And we don't have to worry about it with us being an open system. So we work very closely with a lot of other partners out there that want to validate our resin or their resin on our machines, because they're reliable and they're quality. And if we're going to validate your resin, then they want to work with us. And it just creates this win-win situation. And then you guys, as a dentist and in the dental world, end up benefiting as well, because you're able to get to the end result faster and you're seeing that quality that you want to see out of a mill. So once we get that out of the 3D printer, I think we'll start to see a lot more offices start to transition into the scanner and 3D printers, because those offices that are already 3D printing, their ROI is much greater than the average general practice that's still just outsourcing everything, because bringing things in-house is really where the future of the industry is headed. And the more you're able to do in-house, the more ROI you're going to get, the faster your patients are going to get to their end results, and everyone's going to be happier at the end of the day. So
yeah. And the design service, I want to talk to you about a little bit about that, because that's the part that I don't know, that I haven't experienced yet. I kind of understand the concept of the printing. Like, let's say you have like the resins, the chemistry that's getting better, and you say that this is kind of like open source, whereas as soon as a resin's validated, it's pretty well accepted by the Shining ecosystem. But tell me about the chemistry right now being open source. Companies that have a printer, they want you to buy their resin through their website, right? So you're saying that the Shining printer will say, "Oh, yeah, these are recommended. Go ahead and give it a try." It's such a robust system that it will allow you to put more resins into the printer. Is that right?
Yeah. So our team in Tampa and overseas, and our headquarters in China, they are constantly testing new resins, and we're validating the profiles. So if say you have a resin that we don't have in our system yet, you can, as long as it's not some of the other closed systems resin, we will take that resin in and start the validation process for it and build the parameters. So once you go to print, you just twist the dial until you see that resin, you click it, and then boom, automatically all the parameters are preloaded. And we have what's called an engineer mode, and it doesn't come enabled, but if you want us to enable it, we can. Essentially allows access to this grid of, maybe 30 to 50 different parameters with multiple little boxes that can all be adjusted up or down, depending on, the first 3 layers that it's printing, the cure time. It spends a little bit longer curing those first 3 layers in order for the print to stick to the plate. And depending on what resin we're using, maybe the cure time needs to go up a little bit or be lowered a little bit. And that's just one of the 50 settings that can be changed. So our team validates all of those settings to determine the the best outcome.
I see.
And that's how we're able to adapt and bring in multiple resins. And not so for right now, our printer for a denture or a crown or a night guard, we have at least 3 different resin options for someone to choose from, rather than just saying, nope, this is the only one you can use.
I see.
Yeah.
Okay. So when you're obviously you're going to tell the printer what you're printing, right? What resin you're printing.
Yep.
And then it's going to basically know the optimum settings for each layer, and where to put the supports and that kind of thing, right?
Yeah. So the supports is mostly done in the nesting and the slicing. And so something you kind of touched on earlier was, even for printing a model to, slice it and make sure that it's going to be put, maybe if we're doing like 2 models at a time, it's not as big of a deal because you just lay them flat on the build plate.
Right.
But if we wanted to do, say, 32 models, and not many, clinics are doing 32 models at a time. Maybe a lab is doing that. But let's say you're doing, 6 night guards. Let's say we are doing the 32 models. What's so cool about what our software does is you can upload those 32 models into our slicing software. You click our one-click print. It's going to automatically nest and put them all in their optimal locations on the build plate. So it will place all those little support sprues in their best locations. It's going to print our night guards at the right angle. It's automatically doing it for us. It's called our one-click print. Whereas when I first started selling 3D printers back in 2018, and some of the nesting and slicing softwares are still like this, you have to manually place all these little support sprues in their locations that aren't going to mess with the print. And depending where you're putting these sprues, they can mess with the print. So it's nice not having to worry about that because it's a one-click print. I mean, the AI, it's a wizard. It really does a phenomenal job at putting everything where you need it to be without really feeling like you have to do very much at all. I mean, it takes less than 15 seconds.
Oh, really? Okay.
Yeah.
So that's the difference between 2018 and today, right? That's the major difference, I think, right? AI, basically using AI to set up the prints, right? The one click, So after you do a scan, there's probably a lot of stuff to clean up on the model, right? So it cleans that off and it sets it up with a perfect, and you say, I want a night guard here. And it'll it'll set up the night guard, and how much work is on that design, and how well are you working with that? Will it give you a proposal that you can change?
For the design of the night guard?
Mm-hmm.
Yeah. So you can let the AI generate it, and you can then go back in and make adjustments as you see fit, smooth surfaces off, add material, remove material, check where the contacts are happening between the opposing arches and where the occlusion is occurring. All of it's adjustable. The AI will run a design for you, which takes maybe 2 minutes, 3 minutes at most for it to process all the way through. And then, like I said, you go back in, make the adjustments you see fit. And what's unique about Shining 3D is the fact that you can go from scan to design and print all in one spot. So you're not having to export your scans and send them to somewhere else and then do your design there and then export those into your CAM to do the nesting. It's as seamless as it's ever been. And it's really an area that we shine in, for a lack of a better word. I mean, it's really, go ahead.
Yeah, well, no, it seems like the CEREC of printing, of 3D printing. You know what I mean? Because that's what got CEREC. Nobody else has that kind of seamless integration in CEREC, and I'm not seeing that in printing either. I think that like some of the other printing, the big printing companies, it seems like they want you to use their design services and charge for that instead of allowing the clinician through AI to do it. So I've been really excited about that, and I'm looking forward to taking that next step. Right now, I just have the scanner, and I want to see how that is going to integrate because I'm happy with a mill for like 1 or 2 or 3 teeth. But it's for like full arch night guards, dentures, partials, not metal frameworks yet. I'm sure that's further down the road, but that's the piece, the middle piece where you're getting the design so that you have something you can print. That I've been stuck. I had the frozen. I still have the frozen dental. Frozen
very
printer.
Popular one.
Yeah, and it's about $1,000. It's a good intro. It's basically something that my 9-year-old son Luke is like, I'm making minifigs for him.
We got to get a face scan of him and make a little bobblehead out of him.
That'd be great. I'd love that. But yeah, it's it does take a lot of work getting nested into the slicer software.
Yeah, and like I said, it's come a long ways. And what's so great about our scanner, and again, the AI, is like you mentioned, you might have to clean up some of the model. With our scanner, you really shouldn't have to clean up barely anything. It's totally hands-free. As soon as you click scan, you put your gloves on, you go all the way to the very end, and the AI does such a phenomenal job of cutting out any extra unnecessary data. So cheek, tongue, glove, fingers, it all gets erased through the AI just while you're scanning.
It does seem to know the difference between like what's important and what's not, and takes that out. It's like, okay, we're interested in these structures, and you're right. It is impressive how it does erase that.
Yeah, and it's something that Dr. Ahmad Al-Hassini, sorry if I'm butchering that name, I'm pretty sure that's the correct way to pronounce it, but he is the doc that runs IDD, which is the Institute of Digital Dentistry, and he compares all the scanners, and that's one thing he says that ours excels in is its AI and ability to cut out unnecessary data. Another area he mentions that we have the best thing in is its photorealistic scans. This image you're seeing is the most photorealistic of any other scanner on the market. And so whenever I'm showing and I'm demoing, a case, and I always pull up a couple examples of these soft tissue cases, and people are always like, wow, like it looks like the real thing.
Yeah.
And it's due to the lighting technology that we use. It's a structured white light. And again, coming from having the background of a scanning company, Shining 3D started out in 2004 as a scanning company. So they scanned rooms like we're in, automobiles, airplanes. They got into the dental space in 2014 with our first desktop scanner. And then our first intraoral scanner was launched in 2017. We're currently in our 4th generation. And the current scanner we have, the Aoral Scan Elite, it's the only scanner on the market to combine photogrammetry with intraoral scanning. Being the fact, again, I keep saying it, being a scanning company, they were a leading proponent in the photogrammetry field. We would take these dots, these large dots, and put them on airplanes with these handheld scanners and scan these airplanes with these dots.
Right.
And what photogrammetry is, it's in simple terms, it's taking a shape and correlating the shape to a measurement. So we're scanning entire airplanes down to, less than a 1/16th of an inch in accuracy. If we're scanning these large things, then why can't we take this technology, bring it down inside the mouth?
Right.
And that's exactly what they did. And it really is making us take off here in the last year with the workflow that it provides.
Yeah, that's great. Yeah, I'm using those, scan flags in order to get a great framework, or like all on 6 implants, for example. So you put the scan flags in. You need the orientation of the implants, the angle, the spacing, and then you need to take those off. You have healing collars. I think we put your healing collars into your software, right? The Nobel white ones. So those are in the software now.
On your end, yes, they can be manually downloaded. I don't think they're like in our library itself, but that's what's nice about us being an open system, is we can take other libraries and make them compatible with us. So,
well, I mean, it doesn't matter if I use those white Nobel ones, or anything else.
Right.
I mean, I like any type of healing collar would be fine. I like that it's white. It scans really well. But they are those little white Nobel scan bodies don't really stick to the finger wrench very well, So you're kind of like,
I see.
They're a little bit slippery, and they're hard to get in and off. For a patient that's sedated, you want something that you got a lot more control. MegaGen has an excellent way of like having a little bit of taper that locks into the finger wrench, so you have you're not going to drop anything.
I see.
There's less risk of that. So it might not be the perfect scan body, but it's just something for an example, because you need the scan flags, you need that photogrammetry, and then you also need the soft tissue to align with the facial, which is kind of like breadcrumbs. So the facial, and then the vertical. And then, for example, if we got like 6 implants on the lower, you need to have the soft tissue contour at the time of surgery, for example, and then the facial. That's like the Oreo cookie, and then on top is the upper teeth, and then there's the distance between them.
Right.
And all that information, upper lower scan, bite, 360, and then you have another folder where you have basically an overdenture that captures the soft tissue with the healing collars. All that information, correct, goes to the designer, and then you can get a proposal for a prototype on the lower. And now this is, out of everything else, night guard, crowns, this is probably the biggest bang for your buck when you're trying to print something. So we might as well just go for that and talk about that one, because that would be the reason I'd get into it. You know what I mean? Because
and that's the reason we're proving to be the gold standard in the All-in-X workflows, because of that exact thing. Allows you to print those prototypes in-house, same day of surgery.
Yeah.
You're not having to pre-plan your prototypes and have the provisional done before the patient even walks in. You can do it all same day, as long as you're coordinating with that lab, because of the fact that within our software, all that alignment of all those different steps you're talking about all happens right in one spot. So it saves the lab 30 minutes of time doing this alignment in exocad, so they don't have to do all that because it's all done for them. So they get the scans in one nice file stack. They do their design quicker, send you back that design, which you then print in-house in 12 minutes off of our new printer, and then another 15 to 20 minutes of post-processing. You can send your patient home with teeth the same day the surgery happens. And that's why we're on the map right now.
That's cool. Okay, so what you would do is, after placing the implant, and what I'm doing now is ordering stackable guides to get to that point. And then healing collar, scan, upper lower bite, 360, and the scan flags. There's a coordination with the designer standing by, right? And that designer's, somewhere in the world, and when you click design, right, that's when they go to work on that. And that design takes 10 to 15, 20 minutes or what?
Yeah, depending on their proficiency in exocad or whatever software they're using.
Sure.
Yes. And so the fact of the matter is within the software, the soft tissue aligns to the scan flags as well as the pre-op data aligns to the post-op data. So we make sure that their VDO is exactly where it should be, that vertical dimension of occlusion, and their resting position is as natural as it should be. And they do their design in 20 minutes, send you back that design, you print out, and you're ready to go.